What is chronic fatigue syndrome? Hello, my name is Alois. I'm a medical doctor. I am also a functional medicine practitioner and I have a passion to help people with chronic fatigue. So what is chronic fatigue syndrome? It is also called myalgic encephalomyelitis, and this is a chronic multi-system condition that affects multiple parts of your body. It is not very well understood and it is not very easily treated either. So not every person that has chronic fatigue, of course, has chronic fatigue syndrome. There are many things that can cause chronic fatigue, from infection, poor quality sleep, too much work, chronic conditions like heart disease, lung disease, obstructive sleep apnea, anemia, autoimmune diseases, viral infections like mono, or use of medications, use of toxins or other substances can also cause fatigue, depression, anxiety, and all of that. So out of 3 people that have chronic fatigue, and 2 of them we can usually find the cause pretty easily. And for the third person, oftentimes they have chronic fatigue syndrome that unfortunately is not very well understood, but can affect up to 2.5 million people in America. So what really is this? You have people from any age, but mostly young men and women to middle-aged men and women, mostly women, that are leading a very active life, and then gradually they become extremely tired and they cannot do the things that they used to do before. So this can be for 6 months and on for many years. Some of them, they had an infection like a flu, a virus that never really got resolved. Maybe the cough and the runny nose and the fever has resolved, but the fatigue is lingering on. For many people, we cannot find a cause or a trigger. It could be an immune dysfunction, an imbalance in the adrenal function, energy levels, or a viral infection, like we said before, something that changed or shifted in the body that causes chronic fatigue. So there is no really good way of testing chronic fatigue syndrome, and for that reason, some doctors, they question the validity of this disease. But this is a very, very real condition that has been described and has been studied for centuries in the medical literature. More in the last 30 years, there has been more investigation on this, more studies on this, trying to help these people, because it is still poorly understood and treatments are still not very widely available or effective. So people, they have chronic fatigue, debilitating fatigue. They cannot do the things that they used to do before. Even simple tasks from day to day are now very difficult chores. So they have exercise intolerance. They try to exercise and just makes the symptoms much worse. They have dizziness, lightheadedness when trying to get up, or intolerance to stay standing for longer periods of time. They have to lie down so they can feel better again. Many of them, they have cognitive problems, memory loss, poor concentration, brain fog. Many of them will have depression and anxiety. Of course, that's a result of all of this and feeling really struck down after being an active person in the first place. People can have backache, headaches, and so on. So what is it that we do know? What can really help? So tests that have been done with people being treated with graded exercising, really without much results, or cognitive behavioral therapy, medications not very promising. Now with functional medicine, we have had good results. As you see, with functional medicine, we're not trying to label a person with a certain condition and then give them more medicine, but try to understand the root of the problem. What is causing the fatigue? And a lot of conditions that have previously been labeled as unexplainable, untreatable, they find actually good results and success oftentimes with functional medicine. So the plan is to find out what are the triggers, what is the cause of the issue. Is it toxins? Is it stressors? Is it some sort of inflammation, a heavy metal? Is it adrenal dysfunction? Is it a mitochondrial problem? Is it a hormone imbalance? Is it a microbiome imbalance? So we look much deeper than conventional medicine would to try to find that trigger, try to find the cause, eliminate it, and then bring new balance to the body. Try to find out what needs to be done to keep the body functioning properly in balance and reestablish that health that was there once before. So if this is something that is interesting to you or something you may be struggling with, you have chronic fatigue, you do not know where that's coming from, you have tried different things, just click on the link on the video's description here to find out more, maybe schedule a call with us so we can try to help you and also find out if this is what you need, if this is a program that will benefit you.